A soon-to-be changing of the guard at St. Luke's Health System. President and CEO Dr. David Pate announced he will retire at the end of January. Today, he discusses that decision, how St. Luke's has grown and evolved under his leadership, and how the health system is preparing to treat an estimated 50,000 new patients under Medicaid expansion. Plus, charting the future course for Idaho's public schools. After months of work, the governor's Our Kids Idaho's Future Task Force issued its recommendations for improving education in the Gem State. Among them, increasing teacher pay, creating greater all-day kindergarten opportunities, and better serving students facing emotional challenges. Task Force member and Idaho Education Association President Carrie Overall gives her take on the key points ahead on Viewpoint.
From Idaho's News Channel 7, this is Viewpoint.
Welcome to Viewpoint. I'm Doug Petcash. The last 10 years have seen a lot of changes in healthcare, including the Affordable Care Act, Obamacare, and now this year, Medicaid expansion in Idaho could provide health insurance to more than 90,000 Idahoans. Over that same period, St. Luke's health system has grown and evolved. You see a major example of that with the huge expansion project at St. Luke's campus downtown. St. Luke's president and CEO, Dr. David Pate, has been at the helm of the health system through all of these things. He joined St. Luke's in August of 2009. He just recently announced he will retire at the end of January. Dr. Pate will leave a St. Luke's health system that now includes 8 hospitals: St. Luke's Children's Hospital, Mountain States Tumor Institute, Misty. That's 200 clinics in southern Idaho and eastern Oregon, and more than 14,000 employees. My guest today is still the president and chief executive officer of St. Luke's Health System for a couple more months, Dr. David Pate. Dr. Pate, thanks for being here today.
Thanks for having me, Doug.
Well, I appreciate your time. So why did you make the decision to retire now? Why is this the time?
Well, actually, I had planned this for a long time. When I took the job with St. Luke's, I told the board then I was just going to commit for 10 years, and then it was my intention to retire.
Does it still feel like it's the right time?
It does. It actually, a lot of things are kind of coming together. The things that I set out to accomplish, we've accomplished. And we are just bringing our Strategy 2020 to an end in January. We'll be starting a new 5-year strategic plan, and it just kind of seems right to have the person that's going to be here for 5 years lead and embrace that plan.
So what have you accomplished? You mentioned that you've accomplished those things that you set out to do.
The very first thing was St. Luke's Health System, when I got here, was only 3 years old as a health system. And we were really a confederation of hospitals, not really a system. And so my big first push was to get us to work as a system, and we're doing that. Still lots of work to do, but we've made great progress. Second thing was I promised the board that I would make St. Luke's Health System a national quality leader within 5 years. We did it in 4. And then the third thing was to move from the old fee-for-service model to value, which would help make healthcare better and more affordable, and we have made a huge jump there. We've converted 30% of our business to that new model. And then finally, I had promised the board at the time they hired me that I would develop internal candidates that could be considerations to succeed me, and I did that.
And we'll talk about him in just a moment. What do you think has been the biggest challenge for you, for the health system, for healthcare in the United States in general, specifically here though, for Idaho and healthcare? What's the biggest challenge that you've had to overcome?
It's hard to just name one. The rural nature of our state makes healthcare much more challenging. How do we get the services to people that need it? How do we recruit the physicians we need? I think Idaho's number 49 in terms of number of physicians, so that's an issue. The other thing is, the health of people is so much more than what happens at St. Luke's and with a doctor. It's what we call social determinants of health. It's actually, you're going to talk about education. Education plays a role in your health. Income, whether you're in poverty, all kinds of factors that contribute to health and health care. And so there's a lot of challenges.
Are there enough doctors?
There are not. We're going to have to find new ways to do things.
Are there enough nurses?
There's not enough nurses either.
So that's the big challenge. It's retention and recruitment, kind of just like what education is facing with teachers.
That's right. And so we have to find new ways of doing things, and we are. So one thing is we have brought in a large number of nurse practitioners and physician assistants to work as part of a team with physicians to allow physicians to manage larger populations. And then things like telehealth, where we can actually provide some of these services by telehealth communication, rather than what we used to do is put doctors in cars and send them for several hours away to go see patients.
Oh, you mentioned succession
Yeah.
from you to the next leader. Chris Roth,
Yes.
we have a picture of Chris to show. St. Luke's current Senior Vice President and Chief Operating Officer will take the reins from you after January. So why was he the right choice?
Well, I'm thrilled. The board made that choice. I advised the board about the process, but I didn't participate in the interviews or the selection of him. But it's exactly the selection I would have made if I had been asked to. He's the right person. Chris and I have worked together all of these 10 years, and I think I've promoted Chris 3 or 4 times, and each time we've worked more and more together. Chris and I are very aligned about the vision and where St. Luke's is going, and I think that's really important to people because we have been through a lot of change. We've had a vision, we've had a strategy, we've been executing on that, and our employees and our physicians don't want to make a sudden change. So I think this is going to be really good to have that continuity.
Growth at St. Luke's. Of course, the biggest example of that is the huge expansion project downtown. Specifically with that, why is that going to make it better for patients?
Well, healthcare is changing and is going to continue to change. And so we have new technology, we have new ways of treating people. Just take one example. If you take, most hospitals in this country were built in the 50s for other reasons that I won't get into right now. But if you look at those operating rooms, by today's standards, they are considered very small. And that's because back then, it was just a surgeon and a tech. Now we have all kinds of equipment, robots, teams. And so you've got to redo these things to account for that growth.
How else has St. Luke's grown that people maybe don't see?
Yeah.
Is it on the digital side?
We have. So
technology?
We've actually created a virtual hospital. And so we have a hospital where there are no patients in there, but we have all of our virtual care services where we can provide services to people around the state that don't have to come to us, and we can treat them. We've grown in a lot of other ways, new programs, new services. One of the things I'm most proud about is in pediatrics. So one of the things that has struck me is how much of a burden it is for people in Idaho to have to leave the state to get care for a child. We have grown the number of pediatric specialists at St. Luke's tremendously, so that, and we shouldn't do everything, but we are doing a whole lot more, and now there's less reason for people to have to leave the state. They can get outstanding services right here.
How will Medicaid expansion in Idaho affect St. Luke's?
Well, it'll affect us in a number of ways. First of all, there's a lot of patients that we're currently taking care of that will now be eligible for Medicaid. So we previously were not paid for those services. Now at least we'll be paid something. The other thing is that people will have access to primary care and some of the services that they can get earlier treatment with, instead of waiting till things get serious and showing up in an emergency room. And
it's talk about numbers here too. I mean, the estimate that St. Luke's has put out is 50,000 new patients.
Is what we think we will get.
So how are you preparing for that?
Yeah. So one of the big things we did is to work with our physicians across the system to come up with a new scheduling template where we all agree. Instead of every doctor having their own schedule, we created a new system. With that, we opened up 50,000 appointments a year. So that people could come in. We're creating more extended hours so people can come in after. We can expand those services. We've added more providers. We've added more sites. So we're getting prepared. It will still be an issue, but we're getting prepared.
How long have you been preparing? I'm sure this wasn't like July going, oh, you know what, maybe we should think about this.
No, for years. Obviously, we didn't know that Medicaid expansion would be passed, but we have known that Medicaid expansion or not, we've got to take care of the growing population of Idaho. And so we've been making those changes and trying to get better access for everybody, because even those that are currently insured don't always have prompt access. So we've been addressing this for years.
What are you encouraging those people to do who think they might be eligible or know they're eligible, but they just haven't signed up yet?
Well, the big thing is go to the Department of Health and Welfare website. Learn about what they need to do to enroll into Medicaid if they're eligible. The other thing is go ahead and select a doctor now and go ahead and set up that appointment to come in next year and let us just check you over and see where you're at.
I was going to ask, where do you expect the influx to be most at first? What kinds of treatments are you expecting those new patients to seek?
Because right now very few adults are covered by Medicaid and it's mostly children, but now more adults will. We expect that the biggest growth we'll see will be adults, and that these will be people that have chronic medical problems that have not been cared for. High blood pressure, high cholesterol, diabetes, heart issues, those kind of things. That's why we want to get people into a primary care doctor. Let's assess them, see where we're at, see what we need to do to get them under better control so they don't have a complication.
And this really is going to take a burden off of emergency rooms.
Oh, I think a huge one.
I mean, do you believe that that's one of the arguments for Medicaid expansion?
I do. And especially if we can help educate patients about, here's what you do if you have a problem. Call us here or come here and we will take care of you.
In your opinion, will that then save money in healthcare overall by having patients avoid the ER track?
Absolutely. Emergency rooms are necessarily very expensive because of what we have to be prepared to deal with. And that's not a good place to go if you don't truly have an emergency. So we can provide care in much less costly settings and more effectively too, because the more you break up your health care, the worse outcomes you're going to have. What you want to do is get that all coordinated and provided together by a team of physicians that's going to regularly see you, not episodically see you.
Okay, in the 15 seconds I have left, what's next for you after January?
Well, the first things I told my wife is I'm going to sleep in, I'm going to read a book that doesn't have to do with health care, and I'm going to slow down and get fewer speeding tickets because I don't have to go from meeting to meeting. But I am going to probably go on some boards. I'm going to continue writing, and I'm going to continue teaching.
Dr. Pate, thank you so much for your time today and for talking with us about healthcare, Medicaid, and all those things. And congratulations on your career here.
Thank you, Doug.
All right, take care. Well, providing the best possible education to Idaho's kids is challenging. A group of leaders and educators has been working for months to come up with ideas to meet the challenges. Next, we'll break down the recommendations of the Our Kids, Idaho's Future Task Force.
You're photographed a lot with your leg up in the air.
Can you do that, Ellen?
All new Ellen, Victoria Beckham.
How's David, first of all? Is he still handsome?
We get a leg up on 12 days of giveaways. Plus, spicy questions.
What do you sleep in at night?
Heels.
That is so not true.
I love the idea of it, though.
Okay.
Weekdays at 2 on Idaho's News Channel 7.
Hey, Kevin, you thinking about retirement?
I'd love to, but I'm pretty busy with all this.
Yeah. Hey, let's meet our retirement coach, Avo. A is for taking action.
Not anxiety?
No, Kevin, you're gonna be fine.
You sing?
Barely. V is for variety.
And you dance?
Sort of. Come on. pros for optimize your savings.
Let Avo lead the way.
Visit aceyourretirement.org today.
Nice.
Thanks.
I want some more.
What's he doing?
Lisa, I want some more.
More? He has asked for more!
Thank you.
Well, he did say please.
Yes, he did. And thank you.
Please and thank you. Pass it on.
Thank you.
Welcome back to Viewpoint. According to 2017-2018 statistics, Idaho ranks 44th among the states and D.C. in average teacher salary and 51st last in per pupil funding. In recent years, state leaders have been working to change this by increasing school funding and teacher pay. There's still work to do. As part of that, in his State of the State address back in January, Governor Brad Little announced he was creating the Our Kids Idaho's Future Task Force to make recommendations on how to improve kindergarten through 12th grade public education in Idaho. A previous task force laid out a 5-year plan that just wrapped up. The new task force picked up the ball from there. Now, it recently issued these 5 recommendations to help the governor and legislature to consider as they make budget and policy decisions. First of all, increase teacher pay by updating the Career Ladder program to provide more competitive salaries for the state's most experienced and effective teachers. Offer optional state-funded all-day kindergarten across the state. Create training and resources to better help students with social and emotional challenges. Improve K-3 literacy. In other words, help our youngest students be better readers. And finally, increase flexibility in K-12 funding. Joining me to talk about these recommendations is Task Force member and Idaho Education Association President Carrie Overall. The IEA is the state teachers union. Thanks for being here. Carrie, I've known you for so long and I still messed up your name. Sorry about that.
Thank you. It's
Carrie
good to be
Overall is here today. Carrie, first of all, you were a member of the task force, as I mentioned. Why is it necessary to have task forces, the one previous one and then this one, to look at these issues in Idaho? Why has that been necessary?
One of the things that makes Idaho unique is our ability to collaborate among all the stakeholders. So administrators, school board members, politicians, educators. And so having that broad group of people together, including business people interested in education, to be able to collaborate and say, here's our vision for public education in Idaho. Here's where we think we need to focus our resources and time over the next 5 years. It makes us unique, but it also provides a very good roadmap for how public education can grow and improve over the next 5 years.
Now, those statistics I mentioned, as far as 44th in teacher pay and 51st in per pupil funding, is that also part of the reason bringing together as many minds, stakeholders as possible to raise those numbers?
Yeah, one of the things we saw during the last recession was massive cuts to public education. And despite the increases in investment in K-12 education over the last 5 years, we still have not made up many of the cuts that we saw as a result of that. And so being able to look at that and say, where do we need to continue to invest? Where do we need to improve so that Idaho students have access to the best quality public education? It really helps us laser focus in on some of those areas.
Let's look at some of the recommendations from the task force. First of all, increase teacher pay by updating the Career Ladder program to provide more competitive salaries for the state's most experienced and effective teachers. What specifically is the idea there?
So the original task force created the Career Ladder, but they did not fund the top rung. And so as a result, despite the increases to educator salaries the last 5 years, most veteran educators across the state have not seen the increases that early career educators have. We know that having access to a quality teacher is one of the best things that students have and that will improve student achievement. And so making sure that we have teachers stay in the classroom, especially beyond that 5 and 10 year mark, is key to helping us increase the statistics that we want to see. So we have to be able to do more so that even our rural and most neediest districts can keep experienced teachers in their classrooms.
So you have recruitment, the early teachers, the younger teachers that you were talking about for recruitment, and then raising that salary, but now this is about retention.
This is about retention.
Keeping the older ones.
We want to keep quality veteran educators in Idaho classrooms and not have them leaving out of state or leaving rural districts to come to urban districts with more resources.
Let's go to the second point now too on the list. It's offer optional state-funded all-day kindergarten across the state. How would that work and why is it so important?
We know that many districts across the state are already offering full-day kindergarten. They're using supplemental levies or they're using other resources, literacy funds to pay for that. We know that providing intervention and getting those students that are struggling to read more education early on is key to helping them be quality readers by the time they get to 3rd grade. And so we believe that the more early intervention we can provide, the better foundation our students will have throughout their entire education career.
So that the kindergarten, all-day kindergarten, kind of goes hand in hand with another one of the recommendations, is that was focusing on the K through 3 literacy. So obviously a lot of focus on the youngest.
Yeah, exactly. We know that we need to provide students a solid foundation so that they're successful throughout their career. And we know that if the state increases their funding, then districts that are using other resources to pay for it, that will free that up to then allow them to expand programs for students throughout their district.
Kind of a new, not a new issue among kids and in schools, but a new issue that's really come up in education the last couple of years has been children who are facing social, emotional challenges. And so that's also one of these top 5 recommendations is to focus on that. How does the task force recommend that focus be carried out, and why is that so important?
So the first step is providing additional professional development for educators. The increase in student behaviors, the increase in students coming to school with social emotional issues, mental health, trauma-informed behaviors is on the rise across the state. And many of our educators have not been properly educated on how to best help students cope. And so providing more access for teachers to better support those students will help students be successful in the classroom academically as well as socially.
And finally, the last one on the list is increased flexibility in K-12 funding. That means flexibility in how a district uses the state money?
Exactly. So currently there are about 22 line items that the state says you have to spend it on this. For example, if a district gets $1 million for technology, it's use it or lose it. You either use it on technology or you don't get it. And so we're advocating for having some flexibility in how they spend that. If the district only needs $500,000 or $800,000 of that technology money, they could have the flexibility to spend the remainder of that on a program that is best suited for their students' needs. We know that every district is unique. Idaho loves local control. We believe that we should allow our locally elected district school boards to help figure out what's the best way to help students achieve within their district.
So I mentioned you were a member of the task force that came up with these recommendations. Also, as president of the Teachers Union, the Idaho Education Association, is the union happy with the recommendations that have come out?
We're very pleased with the recommendations. Most of them are things that we've been saying for the last 3 to 5 years, that we have to increase pay for veteran educators. We have to do more to support students in their earliest years of education. And we also have to educate the whole child. We have to be able to provide social emotional support. That also ties right in with increased access to counselors, nurses, social workers, school psychologists. Many of those educators were cut during the last recession. And so as we spotlight the need for students to have a well-rounded education and educate the whole child, providing access to all of those resources will help ensure students are successful within the classroom.
Also, Superintendent of Public Instruction Sherry Ibarra's 2021 budget request asks for more than $100 million more than last year. And she lists her priorities as teacher pay, social emotional learning, and early literacy. And she was a member of the task force, and her priorities seem to be right in line with what the task force is recommending. So are you happy to see that those are her priorities in her budget request as well?
We're very pleased to see that. We know that Superintendent Ibarra was a member of the task force. She's been listening to educators and hearing the concern about need for teacher pay. She's also hearing from the governor that one of his top priorities is increasing teacher pay as well. So really what you see is all the stakeholders coming together, agreeing on priorities. Now it's going to be up to us to help the legislators understand why we see these as priorities so that they fund them and move them forward.
All right, and we'll continue to follow that. Of course, the legislature gets underway in early January once again. Education is always the huge issue. It's the largest part of the budget. It's the governor's top priority. I know it's your top priority as well, of course. So, Carrie, thank you for explaining the importance and how these recommendations could be carried out and what they mean.
Thanks for having me. This is a great time to talk about it, and I'm excited to be here.
Getting it started early once again before the legislature kicks in. So
Exactly.
Thank you.
Yep.
Well, still ahead, I'll be back to wrap things up with just a programming note right after this.
This holiday season, decorate your table with specialty meats, side dishes, and desserts from the Boise Bistro Market, Idaho's ham company. Try Try our famous honey spiced glazed spiral sliced ham, or treat your family to a crowd-pleasing smoked turkey breast or honey spice glazed boneless pork loin, hand glazed in our store for that sweet and smoky flavor. To make your holiday season easy and enjoyable, call the Boise Bistro Market today. We are Idaho's Ham Company, located on Fairview Avenue, just west of Curtis Road.
This is the season I love.
Congratulations.
You made it. I love the holidays. Never too far away.
You're getting brand new computers.
So happy holidays.
Thank you, Ellen.
So happy holidays.
My name's Mark. I'm an alcoholic.
Dorothy T, and I am an alcoholic.
I'm an alcoholic. My name is Victoria.
My journey in AA started years ago when I reached the outside limits of my desperation.
And then these people, just gathered around me. That was the fellowship in action.
If I carry any sort of message with my story, it's that, keep coming back and that this thing does work.
If you have a problem with alcohol, contact AA. It works.
Good morning, Uglyville.
Every ugly doll is unique.
I'm Moxie.
Bobo.
Wait.
Call me Slick Doll.
What?
And every child is too.
They can be pretty lovable.
That's why when you travel, you should make sure your child is in the right seat for their age and size.
This is why you're the wisest doll in town.
Well, keep them safe by visiting nhtsa.gov/the right seat.
Isn't that right, gibberish cat?
Couldn't be better.
Find the right seat today.
The Boise mayoral runoff election is happening on Tuesday, December 3rd. Mayor Dave Beater is running for a 5th term against current City Council President Lauren McLean. Next Sunday morning on Viewpoint, that's December 1st, our Mark Johnson sits down with each candidate to talk about their vision for the city. Again, that is next Viewpoint next Sunday. And that's all of our time for this week's Viewpoint. Thank you so much for watching. I'm Doug Petcash. I'll see you tomorrow on today's Morning News.